I'm back. Allie Talks. How are you, ladies and gents? All right. Last video blog was about our children's um, dental hygiene and about taking care of their teeth at an early stage. Well, sometimes we may not have the money to either get everything that needs to be done with their mouth when problems arise, especially working parents, because many of us here in this country, we're working parents, we have insurance, and even with the insurance that we have, sometimes our insurance doesn't cover our needs, either medical or dental. I will be honest, in the past, the insurance that I've had has always covered my dental needs, my children's dental needs. This time around, the dental insurance that I have now, it does not cover all of my youngest, who is T21 strong, all right, aka he was diagnosed with Down syndrome. He has to have preventative restorative surgery on his mouth, and my insurance doesn't cover it because of certain codes. Depending on the code, a code can mean in one aspect it's needed, the surgery is needed. Another, it can be considered cosmetic. And so my insurance wasn't willing to cover it, or at least not all of it. I found a dental foundation out there that helps children with special needs. That includes the Down syndrome community's children. And I am going to, if you look over my head, I'm going to. Now I'm not going to. I am. I have. I'm doing. If you look above me, you're going to see the URL above my head. Even if you got phenomenal health care, ladies and gents, still save this webpage because you never know what can happen in the future. If your insurance will not cover any or partial or a part of any of your dental needs with your special needs child, this foundation will step in and cover the costs. They do have a cap, but they will cover as much as they can. Once you put your child into the system, they're in the system until they're 18 years old. All you got to do is go on this website, fill out the forms, take it to the dentist. You fill out your form number 1. The dentist will fill out their portion, number 2, and then you can fax it to them if there is no, because it's called Dr. Smiles. If there's no Dr. Smiles representative in your area, you can fax it straight to them. If there is a Dr. Smiles representative in your area, then you will either mail it to them or take it to them, whichever you are able to do. And then after that, they'll look at it, and then from there, they start dealing with the dentist office. How do I know this? Because I'm in that situation right now. My insurance is not covering all of my son's needs, and so literally they're stepping in. I don't have a Dr. Smiles representative, so therefore I was able to actually fax the information to them. At this point in time, I am waiting for everything to finalize before we have the surgery. And so I'm going to go ahead, wind this down. And when everything is completed and finalized, I will come back to you parents and I will let you know the outcome. But again, check this website out. I did find another one, and I was actually corresponding with them also, but I decided to go with this foundation, only also too because they were actually getting back to me a little bit quicker. And so I went with this foundation. And I've so far, even though it's only been, a week or two since I've been going back and forth, I've been actually pleased. And the reason why it's taken a week or two is only because I was on vacation. And so, unfortunately, I could not do what needed to be done in another state. I had to wait till I got back home. in order to complete the transition. And I actually got in contact with them out of state, you know. And so once I found out what I needed to do, that is when I came back home and got the ball rolling. And let me say this, ladies and gents, it only took 2 days to get the ball rolling, you know, and that's because I got home late. And so, ladies and gents, please give this website, this foundation, give them a look over. Even if everything is fine, they help anybody in the United States of America. Give it a look over, because you never know in the 18 years of the life that you have with your children with special needs, you may need this foundation. All right, this is Allie Talks. I'll see you later.